Welcome, everyone, to today's presentation on integrating Maranasati into therapeutic practices, an approach to addressing thanatophobia. I am Ho Hang, and I am thrilled to have this opportunity to share valuable insights on this important topic with all of you. Fear of death is a universal experience that deeply affects an individual's well-being. In our contemporary society, it is crucial to address thanatophobia, an abnormal fear of death. Mindfulness-based practices such as Maranasati offer powerful strategies for effectively managing fear and anxiety associated with mortality. Throughout this presentation, we will delve into the concept of Maranasati and its significance in addressing thanatophobia, which is a fear of death. We will explore the research evidence that supports the integration of Maranasati into therapy, highlighting its effectiveness in helping individuals cope with the fears of death. Given the real-world scenarios involving diverse populations, I will propose an approach for therapists and counselors to incorporate Maranasati into their therapeutic practices. Our ultimate goal is to empower every individual to face their fears, foster acceptance, and appreciate the present moment. By embracing the transformative potential of Maranasati, we can provide individuals with valuable tools to navigate and overcome their thanatophobia in our modern societies. Thank you for joining me on this enlightening journey. Let's begin. What is death? Continuing our journey in the exploration of death, we come across undeniably brief insights from Buddhism, which provide a comprehensive perspective on what death entails. It encompasses the passing away, perishing, disintegration, and laying to rest of various sentient beings, ultimately culminating the cutting off of the life vacancy. This profound understanding illuminates the multifaceted nature of death. In contemporary society, scientific advancements have prompted a re-evaluation of death as a permanent cessation of vital functions. This shift has led to extensive exploration within literature and biomedical ethics, seeking to unravel the complexities surrounding the concept of death. Black offers an ethical and practical approach to comprehending the dying process, focusing on vital aspects such as the heart, lungs, and brain. By examining these physiological functions, we gain insights into the intricacies of the dying process. Hoffman further contributes to our understanding of death by presenting three perspectives: brain function, brain and heart or lung function, and the value of artificial means. These perspectives shed light on different dimensions that influence our interpretation of death and its significance. It is important to acknowledge that while clinical death is often defined solely based on physiological criteria, it frequently overlooks the emotional reactions and moral judgment associated with the experience. Ongoing debates surrounding death necessitate a comprehensive approach that encompasses the emotional, ethical, and spiritual aspect intertwined with phenomenon of death. Fear of death has been a subject of scholarly research, providing valuable insights into its prevalence and manifestations. College and Leicester research in 1969 marked a significant moment in academia, drawing attention to the fear of mortality. By surveying 25 undergraduate females, they assessed different types of fear associated with death. The result highlighted that greatest fear was associated with one's own demise, followed by the fear of one's own dying process. Interestingly, the least fear was linked to others dying, suggesting that personal experience significantly influences the intensity of fear. Fast forward to the present, newly released data from Statista in 2023 shed light on the prevalence of the fear of death. This data, gathered from the sample of 1,220 American respondents, reveals that a majority reported experiencing some level of fear related to death. This demonstrates the widespread nature of the fear and emphasizes its relevance in contemporary society. In the realm of scholar research, Ananaya BQ and his team conducted a recent study that further deepened our understanding of addressing the fear of death. Their rigorous randomized control trial centered on examining the impact of mindfulness practices on the fear of dying and death. Results demonstrated engaging in mindfulness and contemplative practices effectively reduced the fear related to one's own impending death and the death of others. What is particularly intriguing is that these practices also had paradoxical effect of heightening the fear of experiencing others dying, while simultaneously fostering the cultivation of mindfulness and self-compassion. These studies highlight the ongoing interest and importance in understanding the fear of death and finding effective strategies to address it. How do we contemplate death through Buddhist psychological practices? Contemplating death is a fundamental aspect of Buddhist psychological practices, with Maranasati being a prominent approach in this regard. Maranasati revolves around the continuous remembrance and contemplation of death, allowing individuals to cultivate mindfulness and develop a deep understanding of impermanence of life. The roots of Maranasati can be traced back to teachings of the Buddha, particularly the Satipatthana Sutta and the Kayagattasati Sutta. These ancient texts provide guidance on how to cultivate mindfulness and contemplation with death as a central focus. Through the practice of Maranasati, individuals gain a deeper understanding of the transient nature of existence and the inevitability of death. In their work, Ellen and Catherine shed light on an important aspect of Maranasati, known as Samvega or spiritual urgency. This spiritual urgency serves as a catalyst for successful meditation on death. By recognizing the impermanence of life and developing a sense of Samvega, individuals are motivated to engage in this contemplative practice and explore death, the depth of their own mortality. It is worth noting that the processes occurring within our bodies, such as digestion, waste elimination, and the growth and death of skin cells, mirror the impermanence of life. By understanding and acknowledging the transient nature of these momentary dying processes, individuals can gain a deeper perspective and alleviate fears associated with the final passing of the physical body. Maranasati, the practice of mindfulness of death, holds the power to cultivate acceptance by actively engaging individuals in the contemplation of death as an intrinsic part of existence. By immersing themselves in this practice, individuals develop a profound comprehension of life, impermanence, and the transient nature of all phenomena. This transformative perspective allows for a more balanced and constructive approach towards death, enabling individuals to embrace the natural cycle of life and death. Furthermore, The practice of mindfulness death and Omaranasati serves as the potent tool for evoking a heightened awareness of mortality. By embracing this practice, individuals can effectively reduce fear and anxiety associated with the inevitability of death. Through mindfulness and acceptance, individuals can develop a healthier relationship with mortality, leading to enhanced well-being and a deeper appreciation for the present moment. By incorporating Maranasati into therapeutic practices, therapists and counselors can offer clients a powerful means to overcome their fear of death. Let's explore the implementation of Maranasati in therapeutic settings as highlighted in recent scholarly research. In 2018, Gadapur, Ratma, and Josvan conducted a study focusing on women with coronary artery disease. They examined the impact of MBCT on reducing mortality distress. In this population, the result indicated that MBCT significantly reduced mortality distress and improved psychological well-being among the participants. During the same year, Nabipur, Rapipur, and Alizadeh explored the efficacy of MBCT in individuals with cancers who experience suicidal ideation and death anxiety. The findings revealed that MBCT interventions led to a significant reduction in suicidal thoughts and death anxiety, promoting better emotional well-being in this vulnerable group. Furthermore, Baklani, Sati, and Maat investigated the efficacy of MBCT in elderly women, specifically focusing on depression, death anxiety, and life expectancy. The study demonstrated that MBCT was effective in reducing depressive symptoms, alleviating death anxiety, and enhancing life expectancy among elderly women. These studies provide compelling evidence supporting the use of MBCT as a valuable therapeutic approach for addressing mortality distress, death anxiety, and related psychological concerns. The findings highlight potential of mindfulness-based therapies in promoting well-being and resilience in individuals facing the challenges of mortality. Aging is a natural and inevitable part of life. It brings unique experiences and challenges for individuals. As we move forward in our presentation, let us now shift our focus to understanding the perspective of the elderly population. In a study conducted by Fadila, Abeid, and Al-Jilani, 106 elderly Egyptians were interviewed to explore the attitudes towards death, loneliness, life satisfaction, and health status. The findings reveal approach acceptance was the most common attitudes toward death among the aged individuals. This suggests many elderly individuals embrace death as a natural part of life and are more accepting of its inevitability. Understanding these attitudes can help us provide appropriate support and interventions that align with the beliefs and values. In another research study by Nozari and colleagues, the efficacy of narrative group therapy in addressing distress and uncertainties associated with fear of death in older adults was examined. The result also showed promising outcomes as narrative group therapy demonstrated positive effects on aging perception and death anxiety among the participants. This indicates therapeutic interventions such as narrative group therapy can effectively alleviate fears and uncertainties related to death and promote a more positive outlook on aging. Research conducted by Gillespie and Dasbochoji focused on the effectiveness of acceptance and cognitive therapy in reducing depressive symptoms and enhancing psychological well-being in elderly participants. The finding highlights the positive impact of ACT, indicating that it can be a valuable approach in promoting emotional well-being among older adults. By integrating Maranasati principle to ACT, therapists and counselors can further enhance the therapeutic outcomes for individuals struggling with thanatophobia. The combination of ACT's core principles such as acceptance, mindfulness, and value-based action with the contemplation of death and impermanence in Maranasati can provide a comprehensive framework for addressing fear of death. As we move forward, religious attitudes were found to be inversely associated with death anxiety and positively linked to attitudes towards death among elderly patients. Menackley and Dokken examined the relationship between religious beliefs, death anxiety, and attitude towards death in elderly patients in intensive care unit. The research results highlight a potential influence of religious beliefs in addressing fear and anxiety related to mortality. The integration of Maranasati principles into therapeutic settings has the potential to greatly support individuals in developing acceptance, reducing fear, and enhancing overall well-being. Considering a humble body of research discussed, integrating Maranasati into therapy promises a comprehensive approach to addressing thanatophobia and promoting psychological well-being. The practice of Maranasati, as highlighted by BQ Analagio, foster deeper understanding of transcendence and cultivate acceptance, reduce fear, improved well-being, and spiritual development. Moon also emphasized the positive effects of mindfulness of death on life, particularly in an adolescent population. As we look towards future, there is a clear need to expand research on integration of Maranasati meditation in therapeutic contexts. While existing studies have shown promising results, further exploration is required to deepen our understanding of its long-term effects and sustained benefits. By conducting longitudinal study, researchers can examine the lasting impacts of Maranasati meditation on individuals with thanatophobia. This would provide valuable insights into potential sustained positive change and the durability of the therapeutic benefits. Understanding how Maranasati practice can support individuals in the long term is crucial for optimizing treatment approaches and ensuring lasting well-being. Additionally, future research may also focus on refining and developing the approach of integrating Maranasati into therapy. This involves exploring different therapeutic modalities and techniques that enhance the effectiveness of Maranasati meditation for individuals experiencing thanatophobia. Given the research evidence from real-world scenarios, counselors and therapists have the opportunity to integrate Maranasati meditation into future therapeutic sessions, including mindfulness-based interventions such as MBCT and ACT, enabling individuals to cultivate acceptance, mitigate fear of dying, and enhance their overall well-being. Thank you all for your attention and engagement throughout this presentation. I hope that the proposed approach of integrating mindfulness of death into therapy has provided valuable insights and ideas for future research as well as for therapeutic practices. If you have any further questions, comments, or would like to collaborate on related projects, please feel free to reach out to me. Thank you, everyone.